And welcome back. Collective stress and anxiety has surged in the year 2020. Almost 50% of Americans between the ages of 18 and 29 said that they've experienced symptoms of anxiety and depression this year, according to a June survey from the National Alliance on Mental Illness. Now, among those surveyed, women, Black, and Latino Americans were more likely to be affected. The question is, what are the signs and symptoms for you or someone that you care about that may be suffering from serious anxiety or depression, or simply may be in need of professional help? Joining us now to share a little bit more and talk about it is the licensed clinical social worker and an associate director with community mental health services at VNSNY, Deirdré DeLeo. And we're thanking you for joining us here, Deirdré.
Daren, thanks so much for having us and allowing VNSNY to talk about the programs and to talk about how everybody's being affected. It's been one heck of a year, right? We started out with the pandemic. We have the holidays coming up, and that's bringing up a lot of thoughts and feelings for people because we're still dealing with the pandemic. We're still dealing with our children in school, whether they're going in person or hybrid or full remote. We have people that are facing joblessness. So there's a lot going on, and a lot of people are having feelings about that.
And when you talk about these feelings, I mean, people have feelings, but I think the thing that was pretty startling to me was looking, as we said in the intro, those that are between the ages of 18 to 29. Now, normally this is a group of people who, for all purposes, should be pretty stable during the season, but we're hearing more from them. I've got anxiety, and I'm also dealing with depression.
Right. And if they're feeling that, can you imagine what our children are feeling, what our older adults are feeling? We're all experiencing this together. And on top of having all of these extra feelings of depression and anxiety, we still have to social distance. We still are, looking at maybe a second sheltering at home coming up for the fall and the winter. So these are bringing on. So we wanted to kind of talk about what anxiety and depression could look like for someone and when to reach out for help.
Yeah. So let's walk through this. If I'm a person that's suffering from anxiety, if I'm a person that's suffering from depression, I want to be able to understand and know what I'm possibly dealing with here. And some people don't even know. They just have feelings. They don't know that I have anxiety. So for somebody, let's start with anxiety, who doesn't know about anxiety, what exactly is anxiety in terms of symptoms?
Sure. So anxiety is having excessive worry. So, you're feeling anxious most days, and that usually looks at a 6-month period of time. So we're 7.5 months into the pandemic. So if you're still having a lot of worry, and that worry could look like having constant stomach aches, you could be getting tension headaches, you could be feeling really restless and wanting to move around all the time and having a hard time sitting still. It can affect your sleep. So you want to talk to somebody anytime that worry is affecting your functioning. You want to look at, we're all worried, right?
Mm-hmm.
Including yourself, Daren. But if it's affecting your functioning, your day-to-day things, if you're not able to work because you're so worried, or you're not able to take care of your family because you're so worried, or you're not talking to friends, it's time to reach out and ask for help.
Yeah. Let's talk about depression. That is another thing. Sometimes you've got someone who's depressed, doesn't even know they're depressed. For family, for a person, an individual, how do you define depression as far as symptoms?
Right. So you want to look at depression is usually over a 2-week period of time that you want to look at. So if somebody's having marked change in their sleep or their appetite, so someone who was getting normal 6, 7, 8 hours of sleep, and now they're not able to sleep at all, or they're sleeping 12 hours a day, changes in appetite. Some people are emotionally eating. I think we can all identify with that from time to time.
Yes.
Other people have loss of appetite. So if there's a change in your weight of like 20 pounds or more, something you might want to think about if it's over a couple of weeks, you want to look at people who are no longer finding joy in doing things. So if somebody enjoys doing the crosswords, and now it's like, nope, can't do it, don't want to do it, just don't feel up to it. So you want to look at things like that. You also want to look at people who were maybe a little bit more social, and now they're kind of pulling back from everybody, And I know it's harder to look at that in the current times because we're not able to be as social as we were, but we are still able to maintain some contact with our friends via Zoom, like we're doing today, or telephone. So, someone who's a little bit more outgoing and they start to pull back, you want to look at that.
Yeah.
And again, it's something that's going for at least 2 weeks. It's not just one bad day, because we all have bad days. But when you have a series of days that you're feeling like that, some people feel very irritable when they're depressed. They don't necessarily identify as feeling sad, just people
Right.
are getting under their skin more frequently.
So if I'm a person that's dealing, right, and I've got this funk that I'm dealing with in terms of anxiety and possibly depression, I know there's some things I could possibly do in addition to professional help. We always can seek professional help. But what about self-care? Because there may be some things I'm not practicing that could help me out. There may be a different kind of mindset that I need to adopt. So walk us through what are those possibilities for those who are having anxiety and depression, some self-care.
Sure. So self-care has kind of changed in during this pandemic and during these times now. We used to think of self-care as kind of pampering yourself and doing something out of the norm that you wouldn't normally do. Now we kind of look at self-care as keeping to a schedule, making sure that you have consistent nighttime routines, that you get sleep, 7 hours of sleep at least, right? You want to make sure that you're eating every day. For those of us that are working remotely, make sure that you take lunch. We don't always do that. You want to make sure that you're not watching the news 24/7. I know it's hard to do in this environment right now, but you want to unplug from the electronics. You want to put the smartphone away. You want to stay off the internet. You want to give yourself a break. You want to schedule in time to do things for you. If there's something that you enjoy, like reading a book or listening to music, make sure that you take time to do that for yourself.
And how hard is it sometimes to have it together and then you find out, oh my God, I'm really, I'll wait another day. And as you said, a day can actually turn to weeks. And then before you know it, you find yourself in a place that you really didn't want to be in.
Sure. Like I said, for depression, the amount of time that we look at is 2 weeks. So if you're looking at period of weeks that you're feeling in this funk as you described it before and you can't get out of it, you really need to speak to somebody. You can speak to your medical provider. You can reach out to a local mental health clinic. VNSNY happens to have, a whole department to deal with mental health issues. We have a mental health clinic in the Bronx. We have some in-home mental health programs. There's a 24-hour hotline that's run by NYC Well. And of course, all of our programs, including NYC Well, are all funded by the Department of Health and Mental Hygiene. But NYC Well is 24 hours. You have a question, you can reach out and call them and say, here, this is what I'm going through. And they can point you to programs like we have here at VNSNY or other programs that may be more convenient to where you live.
Are we hearing anything in particular, like some common themes or some common threads during this time? I mean, I know we're all dealing with COVID-19. Are there any common threads that you're hearing on your side?
Sure, people are afraid to be outside because of COVID-19. There's, issues about racial inequity that people are worried about. And people are sitting at home with their loved ones more often, so they're seeing things that they wouldn't necessarily see in their loved ones. So if you're concerned because you're seeing these behaviors that we talked about, please talk to your loved one and or reach out to NYC Well to get some help.
Yeah. These are very important information, especially as we get close to the holidays. Thank you for taking the time and sharing with us and being with us here on Open.
Thank you so much for allowing us to talk about our programs, Daren, and, be well.
You stay safe too as well. All right, well, I want to let you know that if you want more information about their programs, as we mentioned, all you got to do is visit their website, vnsny.org. Once again, vnsny.org, or you can call 1-800-675-0391. Once again, that number, 1-800-675-0391. We are taking a quick break. Don't go anywhere. Open will return right after this.